Hello, my name is James Hartsfield, and this is my head, eyes, nose, throat, and ears assessment video. So, initially, I will begin with the examination of the head. First, I will start from a top to bottom approach. I will examine for any sort of deformity to make sure everything is symmetrical. I will feel for any tremors, feel for head position, feel if there's any tilting to one side or the other, back or forward. I will check the skull for symmetry on all sides, including the profile, frontal, and back. I also look for any tics, any facies, any sort of, as I said before, any deformity that is present, either acute or chronic in nature. I will look at the color of the hair. I will look at the color of the nose and the skin. I will look for any cyanosis, any areas of discoloration, any pigmentation issues or disparities in the face. I will assess the temporal arteries to make sure I feel a pulse. I will palpate the saliva glands. I'll then move down to the neck, feeling for fullness and symmetry. Make sure there are no skin folds or any webbing. I'll then slowly turn the patient's head, checking for full range of motion. I also have the patient press against my hand, and then the other side, just to make sure that you can push against resistance and that there's no issues with the muscle. I will observe for the trachea to make sure there's no deviation, to make sure it's symmetrical. I'll have the patient swallow, to feel for the hyoid bone to make sure that I can feel it moving up and down. I'll check the back of the neck, feeling the Spinous process and the paravertebral column. Again, checking for symmetry, checking for any bulging, checking for any areas of compression that there may be. Also, as I palpate it while I'm using a light touch, just to make sure that there's no pain that the patient is experiencing. I will check for the thyroid as well. I will check the right thyroid, having the patient turn their head to the right. And then I will check for the left thyroid, having the patient turn their head to the left. I'm looking for symmetry. I'm looking for any bulges, any goiters that may be present. I'll check also the posterior and anterior angles as divided by the neck muscles, palpating for any changes, palpating for any pulsations. I will then listen for roots in the temporal arteries, eyes, and thyroid. I will then test the mandibular joint for crepitus by placing my fingers on the same spot on both sides of the patient's mouth and having the patient open and close their mouth 1 to 2 times. Feeling for any crepitus, any popping inside the joint. I will then move on to the visual testing of the eyes. I don't have a Snellen chart, but I would have the patient stand 20 feet away from a Snellen chart and instruct the patient that they would use. We're going to test both eyes, one and then the other. If the patient has any sort of visual aid, glasses, contacts, etc., we would test without the aid first, and then we would test with the aid. We would have the patient read as far down on the line as they can with both eyes, testing the visual acuity of each eye. I'll also do tests with the confirmation test to test their peripheral vision. So I'll have this patient hold this paper in front of their right eye. I'll also hold front of my right eye. Sorry, my left eye. Please let me know whenever you can see my finger in your field of vision.
No.
Okay. And now switch and have them do the other eye.
No.
Okay. I will, as I did with the head, I'll be checking the eyebrows for symmetry. I'll also be checking for hair texture and how far the eye extends. Because abnormal extension of the eye, shortened eye, the length of the eye can be an indication of a thyroid or hormonal condition. I'll be checking the eyelids on both sides of the patient's head for symmetry. I'll be looking for any sort of drooping, any sort of lazy eye. I'll also be looking for any flakiness, redness, or swelling of the eyes themselves or in the periorbital area. Moving forward, I'm going to slightly open the eye to check both the cornea and the sclera for any sort of redness, any yellowing, any sort of hemorrhage that may be present. I'll also be looking for any foreign bodies at that time. I'll be looking at pupillary eye color, the iris color. I'll also be looking at pupils. I will check pupil reactivity with a pen light. Check first one pupil, then the other pupil, and then I will check that they have react at the same time in the opposite eye when I shine in the eye. Check for the lacrimal glands just to make sure there is no swelling present in both eyes. Also to make sure that I don't feel any sort of foreign body that may be present in the lacrimal gland. For the corneal reflex, I will take a Q-tip and I will slightly brush the patient's eye, causing them to blink. A slight blink is all that's required. I will check the 6 fields of vision with a simple pen. Just have the patient follow this pen with both their eyes. And what I'm checking for is to make sure that there's equilateral movement of the eyes, that there's no nystagmus, strabismus, any sort of delay in either of the eyes as they follow the object. I'll then have the patient focus on the pen and then slowly move the pen forward to test for accommodation. The rest of the test is with the ophthalmoscope, which I don't have. We will be testing that later during residency. However, during that part of the examination, you would turn on the ophthalmoscope, slowly approach the patient's eye, each eye, making sure that you use your opposite eye to test the eye that you're looking at to avoid any sort of nasal touching. And you'll be looking for lens clarity, retinal color, red reflex, disc characteristics, and any sort of the macula characteristics. Moving on, we'll begin with the ear testing. First, again, you're going to check both ears for symmetry. You're going to draw an imaginary line to make sure that the auricle is not flattened and raises above the line symmetrically on both sides. You're going to be looking for any sort of nodules, any sort of tenderness or painful swelling on the ears. You're also going to be looking for any sort of discharge coming out of the ear canal and any sort of swelling as well. You will take an otoscope and you'll slowly pull up and back. Again, the otoscope will be done at residency, but the otoscope will be testing the ear canal and the tympanic membrane. You'll be looking for, again, both symmetry on both sides, checking for any perforation, any sort of redness or swelling. And if you have the ability to blow air into the canal, you'll be testing both negative and positive pressure to make sure that the tympanic membrane moves in accordance with that pressure. Tuning fork, again, we'll be simulating the tuning fork, but for the Weber test, you strike the fork and place it in the midline of the vertex of the head, testing to see if the patient hears one side louder than the other, and testing to see if they hear one side faster than the other. You will then conduct the Rhine test by again striking the tuning fork and holding it approximately an inch or so from the patient's ear, the posterior of the ear, and then placing it to the ear and to see if there's a difference in sound. There should be a difference in sound. The air conduction should last longer than the bone conduction. And you would repeat this for both sides. For the whisper test, you stand behind the patient and test one ear at a time and whisper 3 different letters, these simple letters. So I'm going to whisper a letter and then repeat, tell me what I say.
A3O. B25.
If they can repeat both, then both sides with the same amount of speed, and they don't ask for repeats more than once or twice, especially if it's in a quiet room, then they pass the whisper test. Moving down to the nose, again, you begin by inspecting and palpating the exterior of the nose for any deformities, any areas of tenderness or swelling, any signs of redness or discharge. You'll check the patency of the nares, first one side and then the other. And again, we'll be simulating the light, but you'll check up inside to make sure you can see the clear pink turbines in both nares. You'll be looking for any sort of septal deviation in the nose, any sort of nodules that may be present. You also test the sinuses, both frontal and maxillary, for any sort of tenderness that may indicate any sort of swelling or infection inside of inside of the sinuses. Finally, moving down to the mouth, you'll have the patient open their mouth. You'll be inspecting the throat, tonsils if present. You're expecting the teeth. There should be a slight overage on the upper teeth and the lower teeth, but they should meet in the back. There should not be any overbite. You'll be checking, have them stick out their tongue. Be looking for any asymmetry in the tongue. You'll also be checking for the hypoglossal as well. If there is any issues with the cranial nerve, you'll see a deviation of the tongue. You'll be have the patient open their mouth and just slowly pull back the upper and lower gums, the upper and lower lips, checking the gums for any discoloration, any sort of ulceration, anything besides what should be just a pink and moist gum area. While you have the mouth open, have the patient say ah.
Ah.
So you can inspect the back of the throat. You'll be expecting the palate and the uvula at the same time, just to determine again any sort of discoloration, redness, swelling, any sort of areas of discharge. Again, if the tonsils are present, check those. For most adult patients, it's very likely the tonsils will have been removed as a child. Finally, have the patient open their mouth, say ah.
Ah. Ah,
Yeah.
hey.
And you elicit the gag reflex. Again, while some of the equipment must be simulated because I don't own it, this would be your essential head, neck, ears, eyes, throat, and nose assessment. Again, looking for mostly any sort of asymmetry, any sort of redness, swelling, or signs of infection that may be present that may require a follow-up. Thank you.